I wanted to touch on the root canals. And again, this book really goes into so much depth about it. But let's talk a little bit about what the actual problem is with having a root canal done. You know, in George Mining talks a lot about the bacteria that they found, that Dr. Price had done a bunch of research showing that they weren't sterile, you know, and that's the assumption, is that they're sterile, but actually they're not. And that's why it can create health problems ranging from, you know, headaches and fog to all kinds of really disastrous health issues.
Yeah, this is probably now more controversial than mercury in dentistry. You know, root canals, it's like the oil change of the dental world. It's just, they're always there. It's just something synonymous with dentistry, right? And it is a bit controversial, and I can understand why. Fortunately, we're starting to see people they want to see proof. They want to see objective proof, especially the establishment. Once, you know, you've got to produce enough to begin to make a pretty good argument that what we're seeing and what we're proving here is actually the thing. And so fortunately, we're starting to see more of that. The concern is, I think it's a pretty good practice in nature that when something dies in your body, you can't leave it. I mean, I'm not aware of anything right now in your body or mine that can die, become necrotic and non-vital, no circulation, no nourishment, and we just leave in there. And that's what a root canal is. It's a non-vital tooth. I'm not saying that there's times when a situation doesn't justify it in a traditional practice. I mean, if you have a tooth that's hurting to the point to where it's irreversible or it is non-vital, you know, that's what that procedure is for. It's a way, and this is where a dentist, and the way I was taught, and well-meaning dentists say, well, of course you want to keep that tooth because it's a priority to help you keep your teeth your whole life. Let's just do this procedure that allows you to keep that tooth and it won't hurt anymore. And
as opposed to extraction.
Exposed to extraction, which isn't a great option either. But it's, in my opinion, the only way you can guarantee that the infection's gone, that you don't have recurrence of infection and exposure to some of these microbes and things that can stem from maintaining dead tissue in your body. So that's kind of the basic premise, is when a root canal is done, it's a non-vital tooth. The procedure is they take the pulp out. If you can imagine an x-ray, you see the pulp in there, but you've got miles of tubules. You mentioned that earlier. And all of those tubules have cells in them because that's what nourishes the tooth from the inside out. And whenever you remove the blood supply, all of those cells die. And you cannot machine out. You can't. I mean, the procedure of a root canal is, we have, you know, dentists have procedures and the techniques and protocols that try to clean all that out, but you cannot clean out miles of tubules. These are microscopic, and there's irrigants that they use that they'll say does it, but there's been studies, Boyd Haley, there's been a lot of studies that have shown that root canal teeth that have been removed for whatever reason, whether they were hurting, a recurrent infection or not, that they're always infected. There's always the presence of non-native, non-commensal, pathogenic anaerobes. Keep in mind, these are dead body parts, so there's no nourishment. So therefore, there's no oxygen. So you have to have bacteria that can live in the presence of no oxygen. And those happen to be the ones that ferment in the toxic byproducts and biotoxins and endotoxins that can produce. And then, so the concern then is, what effect do those have on the systemic health and the mitochondrial function and the enzyme function?
How does this tooth that's, you know, in a layman's term, it's full of bacteria that's just getting putrid, and how does that impact the rest of your body's systems?
Yeah, and I would say too, I mean, it's safe to say a lot of people have mercury and root canals and they're presumably clinically fine. I mean, we've got a practice full of older patients that have things in their mouth that here we're talking about having these negative impacts, and they're fine. They're just fine, right? I mean, or at least
until a major stressor, right? Or until,
well, no. So yeah, at least clinically, yeah. But it's kind of this cumulative effect, and they just might have really high thresholds, or their bodies, maybe it's because of their healthy lifestyle that their body can maintain some of these things. So I'm not saying that all of these problems are always the end point of these of these things are going to lead to all these bad
Right.
outcomes,
Yeah.
but we do see that, and there are vulnerable people, and there are people it happens to. I think I mean, I'm confident enough to make that claim that you see people that because of the dentistry, whether it was the primary cause or certainly cumulative, that can lead to the deterioration of health and some of these problems that set in. But there's plenty of objective studies that are linking some of the presence of these microbes and biotoxins and things with these cellular processes that get interrupted.
Right.
So that's kind of, I mean, that's the overview with endodontically treated teeth, root canals. Now, well, I'll jump ahead. One question was, if you've already got one, what do you do?
Yeah. Yeah.
The best things to avoid them. And that's where trying to be as preventative as possible, as conservative as possible in treating, right? There's a statistic, and I'm kind of guessing at it, but it said something, and this was like an official number, 80-something% of dentistry done day in and day out is fixing work that's aged. So it's basically replacing old dentistry. So the best thing, if you can be as conservative as possible and do these lifestyle practices that prevent the need for dentistry, people are going to need dentistry. You're going to get decay, even though you try your hardest not to, or you're going to have a broken tooth or might need work. But the smaller that snowball stays, if you start accumulating dentistry and then accumulate more, and then it needs to be replaced, you get into a situation where you're having to get root canals or lose teeth because you just start running out of teeth that will fix. So
to deal, yeah.
So prevention or trying to avoid the practice is the best, obviously. Now, if somebody is in a situation to where you've got a choice to make, let's say I'm sitting and you're in the chair and you've got a non-vital tooth. Now, here are the pros, here are the cons. I'm going to give you everything. I'm going to talk to you about kind of what we discussed and let you make a good informed decision on what you want to do. But my recommendation typically is going to be consider removing it. I think there are more predictable, much healthier ways to replace teeth than keep a putrid dead tooth in your mouth.
So the viewer would understand what are some of the potential health effects of leaving a root canal tooth that is putrid, and someone who doesn't maybe have as good of an immune system or has some underlying conditions, what kind of health effects might be seen from this?
He touches on that in the book. I think metabolically, so this is regardless of whether there's clinical symptoms or not, you'll see imbalances. I mean, because of the presence of these anaerobes and the biotoxins, root canal teeth, the recurrent abscess rate of root canals are much higher than natural teeth. By my definition, teeth that have had a root canal are always infected because there's always the presence of undesirable and potentially negative bacteria. By classic dental standards, is there an abscess, right? Are we looking at an x-ray and you see a dark spot, or you've got swelling, or something's hurting? So there's kind of two definitions of infection. Technically, that's more of when you're seeing signs of an x-ray where a dentist looks and says you need a root canal because you've got an abscess, that's usually, if it's not an acute swelling abscess, it's usually your body's kind of controlled it and you're seeing a sign of that on the x-ray, but it's a sign of a dead tooth. And so root canals, teeth that have had root canals, have a much higher chance of reabscessing, which can trigger all kinds of metabolic problems when you have a chronic abscess in the jawbone. So that's a concern in terms of what that can lead to, both locally and systemically. The concern with some of the byproducts, the biotoxins, or how the effect they have on cellular respiration and how we produce energy. So, I think most would say that, people that feel like they're suffering from effects of maybe of a root canal, you'll hear a lot of people that say, this happened and then I started noticing this set of symptoms. Sometimes it's chronic fatigue, joint pain. That's where Dr. Meaning and Dr. Price actually tied those two together. You see a kind of a correlation between infection in the mouth in general and chronic joint problems, whether it be osteoarthritis, rheumatoid arthritis. Not saying that one causes the other, but certainly can tie in together. There's a whole plethora. I mean, he gets into that in that book, and he actually kind of backs it up with some pretty good science.
All the animal studies and everything. So
the animal studies, and that's where Weston Price is. I mean, Weston Price would give a really strong answer if he were sitting here right now on the health effects of having necrotic teeth, because that's what he did in all of his animal studies, is chart that and then reproduce it and then reproduce it again. So
now if someone has had a root canal done, and they, we did kind of touch on this already, but they want to, they're now convinced, okay, this is probably a problem in my life. What are they looking at doing? What is I guess it's extraction. Is there any other option, or
you can't, unfortunately, we can't revitalize teeth. Once they're dead, they're dead. So typically, if it's enough of a concern, and we don't take that lightly, obviously.
Right.
I mean, there's discussion there, and we want to make sure it's got to be something the patient's, wants to pursue. I don't just across the board recommend that everybody with root canals come in and have them out. There's got to be a good reason, and a reasonable reason to even start that discussion, and a reasonable set of what you hope are good outcomes. So again, that's not something that we take lightly at all. But if it is something, or if you just see a dental problem, you see an abscessed tooth, or they, root canal teeth are less resilient, so they break down and decay faster than healthy teeth. But so if you see a dental problem, that makes it an easier decision, because you have to address it. And typically the only thing to undo a root canal is to remove it. And there's protocols that I would call safety protocols that upon removal that we do to protect you while that's being done, and to address some of the infection, and to optimize the regeneration or the healing of the bone afterwards. So that's about the only way you can undo a root canal, unfortunately. And now, I think there was a question about ozone. We use ozone every day. Ozone has its place in dentistry and in medicine. There's some biological dentists that will promote doing root canals with ozone. I think that's great. I think I think ozone does what it does, and I think it has it would have a better maybe chance of helping address an infection when you're having a root canal done. But I still don't think ozone, and a lot of people would agree that ozone is a magic bullet that can allow you to keep a dead body part in your body.
Right. Yeah. It's sort of maybe a Band-Aid fix, but not really getting to.
Yeah. And I mean, going in and doing ozone injections and all, those things may help and bolster some of the local, problems around root canals. But in terms of addressing them or undoing them, unfortunately, the alternative is removal.
Yeah.
And that's always an alternative at the onset. If you're sitting in the dental chair and you've got a situation to where you've got to choose between getting a root canal, the other choice is always removal. And always know that there's pros and cons to that, but there are ways to replace teeth that I feel are much more healthy, compatible, and probably even longer term, meaning they're more predictable.
Are you talking about having like a ceramic tooth put in the place where the other tooth was taken out, or?
Yeah, so a lot of it depends on where the tooth loss occurs. If it's in an area that you may not even have to replace, if it's a posterior tooth and that patient isn't going to suffer from any lack of chewing, or speech or aesthetics, it's always a choice then. So first you determine if it's even a priority for the patient to want to replace it. But replacement options, probably you can do removable stuff. That's okay. I mean, most people want to stay away from things that you have to take in and out, but it is an economical option and a very healthy option. Bridges are great. There's pros and cons to all of these things, but bridges, permanently replace teeth. You don't take them in and out. You can chew with them, you brush with them in your mouth, and they're great. Implants are, I'm cautious recommending those, because then they do have metal and ceramic implants, but that's basically an artificial root screw that gets placed in that site, and then we attach teeth to the top of them. We've got to be careful with those, because you're implanting something in the body, and that's where
And then
So-
you've got to relook at all of the materials and what is that thing that's in there that, you know, how's that going to impact your body?
I believe you should. Yeah. I mean, some would say implants are, and I mean, they work, but I think most patients would need to know the pros and cons of having a foreign material now actually implanted through the barrier into the body, right? And what are the short and long-term effects of that? I mean, they work. There's millions of implants done. People do okay with them, but we see some that don't, and you got to be careful with implants.
Right.
So.
Well, good. Okay. Well,